Thank you, everybody, for coming out this morning. Appreciate the time. As mentioned, my name is Jonathan Hollinger, and I represent a senior living community in Manheim, Pennsylvania. And we've been around for over 67 years, providing jobs and a place to live. The Medicaid reimbursement program has traditionally operated on a cost reimbursement method. Senior living providers were reimbursed for care based on allowable costs. However, this model was modified with the implementation of an annual budget adjustment factor, or often referred to as a BAF, essentially keeping the Medicaid rates flat for over a decade, thus translating to approximately a reimbursement rate of 80% of allowable costs. Now, let's take an example of another industry. Pretend for a moment that a bottle of wine costs the state liquor stores about $10 to place that wine on the shelf and sell it. However, Pennsylvanians state that's a ridiculous price, and I'm only going to pay $8. How long would you be in business? And that's essentially what's happening in senior living. 15 years ago, Pleasant View's medical assistant reimbursement rate was approximately $178 per day. Today, that rate is about $189 today. The mere 6% increase over 15 years does not even cover the current year's inflation. In the last 5 years alone, we have seen certified nursing rates jump from $13 an hour to about $20 an hour, a 60% increase. And this is not enough to keep up with other industries. In the past 10 years, Pleasant View has provided over $30 million in unfunded care costs. I want you to also imagine that you have just completed working a double shift. This is 16 hours due to staff shortages. Mind you, this may be your second or even third job that you work this week. Your nose is rubbed raw from the N95 masks you wore all day. You need a shower badly as you sweated through the scrubs from wearing a plastic gown while bathing residents. You cleaned up human waste. You changed soiled clothes. You comforted a family as they watched their loved one decline in health. You were yelled at, clawed at, maybe even punched. You held the hand of a dying resident while they breathed their last breath. You were exhausted, physically, mentally, and emotionally, and you wonder how long you can keep working this job. You're a CNA, and this is your day. Or imagine working in retail or restaurant or a warehouse boxing up T-shirts at about the same dollar amount, or even more in some cases. Which would you choose? Over the months, I've asked our CNA team members if there's anything that they need, and more times than not, their response is more help. Our workforce is our greatest asset in senior living, and today we're at great risk of being unable to maintain a workforce that can adequately care for seniors. Pleasant View, like many senior living organizations, have ramped up their recruitment efforts and retention efforts, increasing HR marketing dollars, attending job fairs, hosting job fairs, implementing sign-on bonuses, starting Earn While You Learn programs, offering referral bonuses to existing employees, significantly increasing both starting and existing hourly employee rates. Currently, the 17 senior living nonprofit organizations in Lancaster County each average 30 unfilled full-time equivalent staffing positions. Of those, about over half of those positions are caregivers. The current proposal to increase the mandatory hours per patient day from 2.7 to 4.1 is financially impossible and physically impossible. In a climate where daily staff call-offs are the norm, there simply are not enough nurses and caregivers to meet this new regulatory requirement. Over the past 5 years, Pleasant View has seen its workforce compressed from nearly 370 staff to around 245 staff. Like other industries across the state and nation, senior living communities are facing staff shortages in every aspect of their organizations, such as dining servers, cooks, maintenance and grounds, housekeeping, rec therapy, CNAs, LPNs, RNs, and even administrative leadership. With Medicaid reimbursements falling short of costs, it has become a challenge to offer wages that compete with higher pay scales of the hospital systems and non-healthcare jobs. So how have organizations like Pleasant View made this business of senior living financially work over the years? Well, we've charged our private pay seniors approximately 2.5 times the state Medicaid rates and have seen life savings depleted quickly, and those Pennsylvanians being quicker to be covered under the Medicaid program. We've used reserves that were earmarked for building improvements, repairing parking lots, sidewalks, new roofs, or even updates to technology. Those have all been tabled. And we have held staff wages for nurses, caregivers, and ancillary staff to modest levels. This is no longer an option with the competition of higher pay scales in other industries. I would encourage the committee to explore increased Medicaid funding opportunities for senior living organizations to help aid in increasing staffing and operational costs and avoid the massive closure of acute care beds that is already beginning. I would also ask that the committee consider refraining from increasing the hours per patient day from 2.7 to 4.1, as the industry simply cannot cover the costs nor come up with the employees to meet this requirement. Instead, I would encourage the committee to explore changes to the hours per patient day calculation to include additional staff involvement, such as rec therapy, dining, and chaplaincy, all who contribute to the care of seniors. There may also be opportunities to model the state calculations to similar CMS HPPD calculations that give weighted hours to nurses. Lastly, easing regulatory requirements where appropriate around COVID-19 and the employee onboarding process will not only expedite the hiring process, but also aid in attracting and maintaining staff in senior living. Who has heard of a PA HON? Has everybody heard of the PA HON? No. For senior living, and in fairness, I had never heard of PA HONs prior to COVID-19. Since 2019, there have been 202 PA HONs issued. Now, a PA HON is a communication from the Pennsylvania Health Alert Network. These communications will at times change current Department of Health regulations, issue new mandates, supersede previous PA HONs, and often require overnight changes to policies and practices that will need to be implemented the next day. Any help you can do in making the regulations a little easier will go a long way. The heightened regulatory requirements and continued underfunding of Medicaid for senior care will cause organizations like Pleasant View to continue to lose staff and be forced to provide care to less and less seniors. And entire nursing wings will continue to shut down. Pleasant View has already shut down 2 nursing wings. This will lead to acute care for seniors being provided at much higher costs in an already taxed hospital system. Senior living organizations simply cannot shoulder this financial and administrative burden any longer. I appreciate your time for listening.